Good morning, everyone. Good morning, Sir Kurt. Praise be Jesus and Mary. Today, I'll be discussing about Indonesia's demographic data over the past few decades. Let us have our learning outcomes. In this presentation, we'll look at how Indonesia's population has grown and transformed over time. What are the key indicators that define these changes and the forces behind that have shaped it? We'll also discuss what these demographic changes mean for Indonesians' future, including the opportunities and challenges ahead. Indonesia's population growth trajectory. Indonesia's population both experienced rapid expansion and gradual moderation. If we look back to 1970s, the country had just over 115 million people, while today that number has more than doubled, surpassing 270 million. However, the pace of growth has not remained the same. In the early 1970s, the annual growth rate stood at about 2.4%, meaning the population was doubling roughly every 30 years. Fast forward to today, that rate has slowed down to around 1.1%. Actually, this slowdown isn't accidental. It is the result of deliberate and coordinated national efforts. Example of this is family planning programs such as Keluarga Berencana or Two Children is Enough campaign. These programs expanded access to contraceptives, encourage smaller family sizes, and use culturally sensitive messaging to resonate with communities across the archipelago. Another one is economic development. Um, as Indonesia shifted from a largely agricultural economy to one focusing on industry and services, their lifestyle has changed. People began to live more in urban areas, pursue higher education, and delay their marriage, which naturally resulted to reduced birth rate. So, while this growth rate have slowed, well, the growth rate Indonesia's growth rate have slowed. The overall population is still climbing, adding millions each year. So this means that the country must balance the benefits of slower growth with the continuing demands on housing, healthcare, education, and job opportunities. So, in short, Indonesia's population growth trajectory tells us two things. First is that the country has been successful in managing rapid growth. Second is it still faces the challenge of meeting the needs of a large and continually expanding population. Key demographic indicators. So, when we talk about Indonesia's demographic transformation, we're really talking about a complete shift in how people live, grow, and age over time. Um, let's start with fertility rates. In 1968, the average Indonesians women have about 5.6 children. Every woman have 5.6 children. By 2022, that number had dropped to just 2.3. So this is one of Asia's most successful stories when it comes to lowering birth rates on their country. This reflects that not only the family has better access to family planning, but also the raising educational level, especially for women, and the economic realities of raising children in a modern economy. So let us have the infant mortality. In 1970s, 142 out of every 1,000 children or newborns didn't survive their first year of lives, and and that number has now dropped to just 21. This is an indicator that Indonesia's healthcare improved a lot. They have more trained midwives, better access to clinics for their vaccination coverage, and significant public health campaigns. So it is also a sign that the family can feel more secure about having fewer children, knowing that these children are more likely to survive and thrive. Then we also have the life expectancy. So back in 1970s, the average Indonesian could expect to live about 54 years. Today, that figure is 72 years. So, however, women live slightly longer than men, around 74. So, there's 2 years gap, 2 years nga upon sa women. This jump is reflects better to Indonesia's better nutrition, improved healthcare, and reduction in infectious diseases, though challenges remain too in rural and remote areas. And finally, let age distribution. The median age has increased from just 17.6 years in 1970s to 30.2 years in 2020. This means that Indonesia is gradually shifting from a very young population toward a more mature one. With fewer children being born and people living longer lives, it also signals that the country is entering the early stages of population aging. Something that will have a big implication for the economy, labor force, and social services in the decades ahead. So they can so this indicators that tells us that all of these indicators tells us that Indonesia has moved from being a young, high fertility society to one experiencing slower growth, longer lives, and the beginning of an aging population. This sets the stage for new opportunities but also new challenges. Let's proceed to evolving age structure. So if we go back to the 1970s, Indonesia's population pyramid looked like a classic triangle. Almost half, about 45% of the population was under the age of 15. This was typical of a high fertility developing country where large numbers of children are born each year and fewer people live to older ages. Fast forward to 2020, and the pyramid shape has changed dramatically. It's now more like a common column with a much larger population of people in the working age group, those age 15 to 64. So today, they make up to about 68% of the total population, and this shift is known as the demographic dividend. It is a period, so someone in demographic dividend, it is a period when there are more people working and fewer dependents to support, creating a potential boost to economic growth. This demographic dividend is a window of opportunity for Indonesia, as with more people in the workforce, there's a chance for higher productivity, more savings, and stronger economic performance. Well, if the country invests wisely in education, skills training, job creation, and healthcare. At the same time, the population over age 65 has been quietly growing. In 1970s, only 2.5% of Indonesians were seniors. By 2020, that number had climbed to nearly 6%, and it will rise even faster in the coming decades. So, this is the early stage of population aging. And while it's not yet a major burden, it's a sign that Indonesia needs to prepare now through as they have to prepare the pension system, elderly care infrastructures, and health services for the aging citizens. So let us now proceed to economic factors driving demographic changes. So, one of the most influential forces behind Indonesia's demographic shift has been urbanization. So, in 1970s, only 17% of Indonesia lived in cities. By 2020, that number had skyrocketed to 56%. Moving to urban areas often means better access to jobs, educations, and healthcares. But it also changes family dynamics. City living is more expensive. Housing is smaller, and the cost of raising children is higher, all of which contribute to smaller family sizes. So, alongside urbanization, there's also economic development. Um, Back in 1970s, GDP per capita was just $82. By 2020, it has reached to $4,135, So this shift from an agricultural based economy to one led by industry and services has created millions of new opportunities. But it has also changed the economic value of children. Well, in the rural areas, in rural economies, children often contribute to through farm work from a early age, while in urban industrial economies, children are more likely to be dependent to their parents for a longer period as they have to go through schooling and the higher living cost. So another critical factor is female labor force participation, which has risen to 53% by 2020. As more women enter the workforce, many delay their marriages and childbirth to pursue education and careers. And this has a direct impact on lowering fertility rates and changing household structures. So economic growth um, economic growth also encourages investment in human capital. Let's proceed to family planning program. So Indonesia's family planning journey began in under President Suharto with the establishment of the National Family Planning Institute. At the time, the country faced rapid population growth and while having limited resources to support it. So one of the most well-known initiatives was the Keluarga Berencana or Two Children is Enough campaign. So this program didn't just rely on advertisement; it worked through community outreach, engaging religious leaders, village heads, and local organizations to make the message culturally acceptable across the archipelago's diverse regions. So, a key part of its success was also accessibility. So, mobile clinics reach remote islands and rural villages, bringing contraceptives, counseling, and maternal health services directed to the families. The introduction of the Blue Circle logo made the program recognizable and trustworthy. So, over time, the program evolved in the 1990s and 2000. So, family planning services were decentralized into local governments and integrated with maternal and child health programs. More recently, there's been a renewed emphasis on adolescents' reproductive health. They recognize that informed young people makes healthier, more responsible choices. So, what's remarkable is that Indonesia achieved this reduction in fertility without coercion. So, a stark contrast to some other countries where they really coerced or they coerce their people to reduce the fertility rate of their country. So, by working with rather than against cultural and political values, the program avoided resistance and gained public trust. So, as a result, the fertility rates dropped for over 5 children per woman in the late 1960s to just over 2 by 2020. So the policy success is one of the main reasons Indonesia was able to slow population growth and open the door to its current demographic dividend. So let us have the healthcare improvements. So Indonesia's healthcare system has made tremendous progress over the past 5 decades. Through though challenges remains, um, one of the earliest milestone was the introduction of community health centers known as Poskesmas in every sub-district. So these centers become the backbone of primary healthcare, providing essential services to even the most remote areas. Another transformative program is training of village midwife or bidan disa. This significantly reduced maternal and infant mortality by ensuring that births were attended by skilled health professionals rather than relying solely to traditional practices. And in 2014, Indonesia launched Jaminan Kasihatan Nasional or Universal Health Coverage. This expanded access to medical services for millions of Indonesians, especially those who could not previously afford treatment. So, because also of this, child health has also benefited a lot. So, from expanded vaccination programs covering illness such as polio, measles, and tuberculosis. So, this effort drastically lowered child mortality rate from 142 deaths per 1,000 live births in 1970s to just 21 in 2020. So, but however, it's important to note that progress has not been evenly distributed. So in rural areas, eastern provinces, and the other islands still faces shortage of doctors, hospital beds, and medical equipment. So in 2020, the number of doctors per 10,000 people and hospital beds per 10,000 remained significantly lower in these areas compared to major cities. So despite these priorities, the overall the overall healthcare has a major improvement. So it resulted to longer life expectancy, healthier children, and reduced mortality rates. So these health gains combined with falling fertility have been a key in moving Indonesia toward a more balanced and aging population. Uh, Educational expansion and women's empowerment. So in 1970s, the average Indonesian women aged 25 or older had just 1.9 years of schooling. So by 2020, that number had jumped to 6.8. Um, that's more than triple for educational level in just 2 generations. So primary school enrollment for girls has also soared, reaching 90% in 2020, nearly equal to boys. This is a major achievement in closing the gender gaps in education, and it has far reach effects on society. So, um, also, research consistently shows that education is one of the strongest predictors of lower fertility, as women with more schooling tend to marry later, have fewer children, and invest more in each child's health and education. For example, the average age of first marriage for women rose from 17.7 years in 1970 to 21.3 years in 2020. So, education also empowers women to make informed decisions about family planning, career choices, and personal health. As more women have entered the workforce, 53% by 2020, their economic independence has grown, further influencing their marriage and fertility. So, also, government programs such as the school operated assistance initiatives have played a big role in the transformation, making education more accessible by providing fundings to school and reducing the cost for families. So, in short, education has acted as both a um, direct and indirect engine in of demographic change. So it shapes not only how many children families have, but also how healthy and prosperous those children can be. Cultural factors and regional variation. So Indonesia is home to over 300 ethnic groups spread across 17,000 islands, each of which has its own tradition, belief, and social norms. So these differences means that the demographic change doesn't happen at the same pace everywhere. So, for example, in Jakarta, the fertility rate is just 1.8 children per woman. So that is below the replacement level of 2.1, while in West Java, it's slightly higher at 2.2, but in East Nusa Tenggara, fertility remains at 3.4, and in Papua, it's 3.7, more than double Jakarta's rate. So why such differences? So it is because of religious and cultural norms. In some regions, traditional family structures emphasizes having more children, both for cultural pride and for practical reasons. So, like supporting their family farm. So, in others, such as modern urban cities, life makes large um, urban life makes large families less practical, as just like what mentioned earlier. Um, Small rooms, small houses, higher cost of living. So development levels also vary widely as provinces with better access to healthcare, education, and economic opportunities tends to see lower fertility and higher life expectancy. Regions that are more rural or remote often experience a slower demographic transition because access to the services is limited. So basically, demographic patterns means that pol- policies need to be adaptable. So what works in urban Jakarta might not works in rural Papua. So successful programs are those that respect local culture while introducing gradual sustainable changes. So while Indonesia's overall demographic trends are heading to one direction, towards smaller families, longer lives, and are more urban living, the path each region takes to get there can look very different. So the last slide, um, demographic challenges and opportunities. So right now, Indonesia is in the middle of demographic dividend. It is a period where the working age population 15 to 64 is large compared to the numbers of dependents. So this window of opportunity could last to 20 to 30 more years, offering the potential of strong economic growth. So, but to truly benefit, Indonesia's have to invest heavily on education, skill training, job creation, and healthcare. Without this, the dividend could be wasted. So this opportunity comes with challenges. So one of the biggest is population aging. So by 2050, about 16% of Indonesians will be over 65 years old, almost triple today's share. So this will put pressure on pension system, healthcare services, and elderly care infrastructures. If not addressed early, it could slow economic growth and increase public spending burdens. Another challenge is urbanization pressure. As more people move to cities, housing, transportation, and public services will face growing demands. In Jakarta is already one of the world's most densely populated cities. Will especially feel the strain unless urban planning keeps pace. So, um, finally, regional inequalities remains a concern. While some provinces are advancing quickly through the demographic transition, others are lagging behind, which could widen economic and social gaps if not managed carefully. So, in summary, Indonesia's demographic future is a balanced act, capitalize on today's working age advantage, preparing for tomorrow's aging population, and ensure that growth benefits all regions. The choices made in the next 2 or 3 decades will remain determine uh, determine whether the transformation leads to sustainable prosperity or missed opportunity. So that ends my presentation. Thank you for listening.